Hello my friends, welcome to one of the interesting discussions I'm going to share with you today, and this is a difficult proposition, which is the case of hydrocele. Hydrocele generally mentioned by conventional physicians as a case of surgery, but there are cases where homeopathy can do wonders, and I'm sharing these cases with the young generation homeopaths, the budding homeopaths, to instill their confidence in homeopathy. And you have heard me say this innumerable times previously, that what I can do, you can do as well. So it's not complicated, it's simple, and see how the beauty of simple, classical, practical homeopathy works in day-to-day world. So this is an interesting case of hydrocele. The young boy came to me at age of 3.5 years with a complaint of hydrocele. He had this right-sided hydrocele since birth, and the swelling was interestingly more in the evening, before urination, better after urination. He catches cold quite easily with sneezing and runny nose, and he also had sometimes nasal congestion, could have resulted in snoring. He used to get nauseous while eating, especially rice, and he also had frequent bouts of motion sickness. Appetite was quite poor, and when he was hungry, he couldn't tolerate it. Mother complained that his child was of a restless nature, running and jumping was quite a lot. Head to foot, some degree of earwax, some odor from the mouth, offensive urine, frequent growing pains which were worse at night on lying down, and the mom had to press the legs, which used to make it better. Nail biting was there. Hot and humid weather, he used to get prickly heat. Temperament, quite irritable, restless, I already mentioned that. Social, stubborn, strong fear of darkness and ghosts. Interesting thing about his case was he was a twin, and mother could not always look after both the twins together, and so he was many times under the care of the maternal aunt, and emotionally very attached to her. And when she got married, the maternal aunt got married, and there was a sense of detachment. And when the aunt had a newborn baby, he was really jealous of the newborn baby, because aunt's all attention was being directed towards the newborn instead of him. So that was one of the interesting backgrounds of the case. Obviously may not be an etiological factor, but that was present in his case. He was quite affectionate. He wanted to hug people, wanted to be himself hugged and affectionate towards others, and he wanted that affection towards himself as well. Food desires, salt and salty, didn't like sweets much. Stool was average. Jaundice in the past as a newborn. Family history, diabetes and hypertension were quite strong in the family. Now if you go back to the entire history of the case, as I shared with you, right-sided hydrocele. Swelling was more interestingly in the evening, used to be better by urination. A child with a recurrent cold, and the past history where the child was devoid of affection and was extremely jealous towards the newborn. We had started in this case with Apis mellifica in June 2023. Right-sided hydrocele. Apis, my friends, is a right-sided remedy. And Apis has got a tendency of dropsy and edema, so right-sided. Like the honeybee, Apis is also very restless. The honeybee moves from flower to flower in search of a pollen. And similarly, Apis mel is also a very restless individual. You'll see a lot of restlessness in Apis, like in the child. The queen bee cannot tolerate any other queen. It is extremely sensitive to other bees' entrance in the nest. And similar degree of jealousy you'll find in Apis. One of your leading jealous remedies, A, but B in case of Apis mel, there is also ailments from jealousy, etiology from jealousy. So that was one of the important factors. Obviously, we're not sure whether jealousy was an etiological factor in his case, but there was a lot of jealousy towards the newborn of the aunt. 200 followed by 1M. I've shared this with you in my discussion on potencies. If you have a look, that when you're prescribing on the basis of etiology or question mark on etiology, then two succeeding potencies work best. Here 200C followed by 1M. Phobista mentions this in his book Tutorials in Homeopathy. that 2 succeeding potencies work best when you're prescribing on the basis of etiologist. So 200C was prescribed in the first week, 1M in the third week. And the dispensing, I've already discussed that in many discussions previously, go through that, and that's a classical way of dispensing. PL is placebo. There was a little bit of improvement, swelling feels better, but again, standstill condition in December, and we went from 1M followed by 10M. Some degree of improvement, some symptoms were recurring. Hydrocele was around 25% better overall from the start of treatment, but not much change since the last visit. So we went to a higher potency, 10M followed by 50M. You see, one of the important things to learn in different cases, you have seen my case videos as well, that when the patient is improving on a particular remedy, please stick to that remedy. As the mom said, it was around 20-25% better since the onset of treatment. We tried going up to the highest potency to extract as much as you can out of APIS before changing the plan of treatment. So we went from APIS 200 right up to 50M since February. But even after 50M, there was not much appreciable change after the last dose. We reassessed the case. And in March 2024, considering right-sided hydrocele, considering the swelling which is worse in the evening, in a child who is chilly, who has fear of darkness, and there was capriciousness. He wants things, but when he gets it, he does not want it anymore. So, desire for things which are not to be had or which when offered is refused. And that capriciousness you'll find with lycopodium. So, lycopodium was prescribed, and here we are not prescribing on the basis of etiology. So, you see just one potency of 200C. So, lycopodium is a right-sided remedy like APIS. Lycopodium has an evening 4 to 8 p.m. aggravation. In an irritable child, in a capricious child, fear of darkness is not the top factor for lycopodium, but still these were important points in prescribing his case. Hydrocele was standstill, we went to a higher potency, 1M. There's some degree of improvement in October after 1M. Wait and watch, www, wait and watch with wisdom. When the patient has improved, do not touch the patient. Placebo in October. February, we went to a higher potency, 10M of lycopodium. There was a lot of worm infestation and the mother was contemplating giving him anti-deworming medicines. We gave him Embellia ribis. I want you to have a look, everyone, in your Boricase Indian drug section. This is a wonderful acute worm medicine, Embellia ribis, where you can have worm infestation, and there is many times Liontaria, undigested food particles in the stool, with Embellia ribis. So it works wonderfully for acute for worm infestation, with grinding of teeth, with itching of the nose and anus, and very many times Liontaria, which is an important factor for Embellia ribis. 10M of lycopodium was prescribed, and after 10M, it was much better in February. The hydrocele was almost gone, mother said, with the 10M potency. You see how after 200, there's no change. 1M, little bit of change. But when we went to a higher potency, 10M, the patient was much better. Hydrocele was gone by April. And he came back in July. Appetite was poor, but hydrocele was gone. This is the first ultrasound done in December 2022, which shows a right side of hydrocele, moderate amount of collection seen in the right scrotal sac. So a right-sided hydrocele. And this was the ultrasound which was done after the treatment. You see no obvious abnormality detected. The date is not quite clear here, but it was done in around July 2025. So a surgical case of hydrocele which homeopathy could help, and the patient got better, the hydrocele was better. You know, many times you have to understand, going back to the case, if there is an etiological factor, etiological block, always address that and then go ahead with the constitutional prescribing. You see, APIS we had started the case with, considering perhaps the jealousy towards the newborn. The ailments from jealousy could have been a factor in a restless individual. So APIS may not have helped completely in curing the hydrocele, but it helped remove the etiological block, which in later on helped the lycopodium to work. So APs, we had gone from 200 up to 10m and 50m. So it helped to remove or address to a certain extent the etiological block caused by the jealousy. But once you had taken off care of the roadblock, and lycopodium did its bit. Right-sided with an evening aggravation in a chilly patient who was capricious. You see, when the patients did not show any change with 200, see, many of you will change the remedy. Well, lycopodium didn't help. But stick to it with another potency. Try another potency before giving up on the remedy. So after 200, we went to 1m. 1m showed improvement. A little bit of change. Hydrocele, you see, swelling in the evening was better with 1m. And then when we went to 10m after that, the patient started to drastically improve. The hydrocele was gone after the dose of 10m. Embellia ribis was given in tincture, which helped to address the acute worm infestation so that the mother didn't need to go for the deworming medicine. All the organopathic tinctures which I have shared with you, which I will share with you, are very helpful to wean off the conventional medicine so that the patient doesn't need to resort to conventional medicine for any acutes. And that is very important to hold on to patients, especially in this drug dependent world when they, conventional remedies are just thrown off for everything. So lycopodium 10m helped, and you see the hydrocele was much better with 10m. The collection of sac in the scrotal sac was completely gone, and nothing better to verify that, vouch for that, other than the final investigations. Now discussing a few therapeutics of hydrocele. These are from Borica's Metromedica and Boger's repertory. Borica's repertory and Boger's repertory. Now the interesting things about the therapeutics of hydrocele. Injury to the hydrocele. Clark's repertory mentions sambucus as one of the top remedies, only single remedy in fact. Injury to the hydrocele, sambucus. I've never prescribed sambucus, to be honest, on the basis of that. But injury to hydrocele, sambucus is one of your single remedy rubric for hydrocele. Hydrocele of newborn children, so just born, abrotenum is a single remedy rubric for that in Clark's repertory. Now with abrotenum, many times you will find oozing from the navel of infants. So there is a oozing after the birth, once the umbilical cord is cut off, there is oozing from the navel. And the children, as they grow up, are very cruel, very inhuman. It is a brother remedy to tuberculinum. So very cruel, very inhuman. They're eating well, but yet losing flesh. You'll find that in abrotenum as well, just like tuberculinum. So hydrocele of newborn infants with oozing from the navel of infants, with a cruel, inhuman nature, which is very similar to tuberculinum, and the losing flesh while living well. That you'll find with abrotenum, that will find with close to tuberculinum. Now, a few other therapeutics of hydrocele. This is again from Kane's repertory. Left-sided hydrocele, digitalis and rhododendron are the top remedies. Caused by a bruise, Kent mentions arnica. Obviously, you know arnica and conium are remedies for etiology from injury and affecting the gland. So, arnica and conium can come in handy. But do also remember, if those two fail, sambucus is also a remedy for injuries which cause hydrocele. Many times you will have herpes with hydrocele. Graphitis is one of the remedies to be thought of in such cases. And suppressed eruptions resulting in hydrocele, abrotenum, calcarea, helleborus. Clark's dictionary mentions a few very interesting remedies for therapeutics of hydrocele. Abrotenum, I already shared that with you, newborn children. So it is a congenital condition with emaciation, losing flesh. Now, very many times, my friends, you will come across cases where the patients have renal failure, chronic kidney disease, and there is a generalized dropsy as a consequence of chronic kidney disease. And with the generalized dropsy, the patient also has a huge swelling in his testes. Hydrocele has developed. Ampelopsis quincifolia is a very interesting remedy. Worthington mentions that renal dropsies can be cured with it. And with the renal dropsy, there is hydrocele, chronic hoarseness, and like lycopodium, a 6 p.m. aggravation. Lycopodium obviously has a 4 to 8 p.m., but here a 6 p.m. aggravation. So cases of kidney failure, renal failure with huge swelling of the testes with generalized dropsy. Along with that, throat is affected, hoarseness, and a 6 p.m. aggravation for ampelopsis quinquefolia. You can use 30C, 200C for this very useful remedy. We've already discussed about Apis. Digitalis is a very underrated remedy, my friends, for cases of hydrocele. I've prescribed Digitalis very often for cases of hernia and hydrocele. Remember, it's a case of left-sided hydrocele, left for Digitalis. Huge swelling, it feels like it's a bladder filled with water. But one of the very interesting factors for Digitalis is its modality. For Digitalis, do always remember the patient is worse from movement, aggravation, motion. So when he walks, when he moves, when he plays, the child's hydrocele is swollen. If he rests, if he lies down, the swelling is much less. Similar for hernia. When the child is playing, exerting himself, the left side of the hernia is swollen. He's at rest, it's much better. So that aggravation motion, which you find with cases of heart as well, like palpitation for Digitalis is worse from motion. That similar degree of aggravation motion is also reflected in his hydrocele, where it's worse from movement. So left-sided hydrocele, try this for cases where it feels like a bladder filled with water. In a child or in an adult where it is aggravation from motion. Remember, that works wonderfully for Digitalis. Another very interesting tip for Digitalis is one of your remedies for desire for bitter. Naxomica, Digitalis, Graphitis, Natrum Mute. These are 4 remedies which have a strong desire for bitter. Bitter food, bitter chocolate, bitter gourd. So with that desire for bitter, a left-sided hydrocele works wonderfully for Digitalis, especially if the modality is aggravation motion. You lifted something heavy and few weeks after that the hydrocele started. So overlifting causes hydrocele, remember that's Rustros. So injury to the injury causing hydrocele, Arnica, Conium, Sambucus. Whereas overlifting, overstraining causing hydrocele, that's definitely Rustros. Helleborus is an interesting remedy, but I haven't prescribed that very often for cases of suppressed eruptions resulting in dropsy and hydrocele. So Helleborus can also be thought of. There's a very interesting book by Jar, 40 years of practice, and there Jar mentions that he has cured lots of cases with graphitis and rhododendron. And in case of children, Calcaria carp. So Jar's clinical tips for hydrocele is graphitis and rhododendron, but Calcaria carp also wonderful in cases of children. Another very important and interesting book for understanding hydrocele is Lilienthal. Samuel Lilienthal has a fantastic book on therapeutics. And there he mentions in the discussion of therapeutics of orchitis and other affections of testes, few very interesting remedies. Apis, Lilienthal mentions that the hydrocele can be followed by a bee sting. So that's an interesting thing because Apis is prepared from the honeybee. Arnica, Lilienthal mentions that it can be caused after a bruise and testes look purple red in color because of the history of injury and ecchymosis. Arnica, arsenic, rawness of the scrotum with a bluish look in small children. But you understand for arsenic you need the generals, the restlessness, the anxiety, to some extent the burning in the scrotum. Those are important factors for arsenic. Autumn met is a very important remedy for testicular affections. Remember in autumn met what happens more than hydrocele, it's a remedy for atrophy of the testes. A. B. Right testes is affected. C. You see it's mentioned especially in pining boys, children who are very emaciated, and you'll find the line in Allen's lacking in boyish. So there is feministic features in case of autumn met, lacking in boyish, B-O-I-I-S-H. And very many times C or number 3, right testes is affected. And number 4, it feels as if a knife is being drawn through, a knife-like stabbing pain you'll find with autumn met. So A, atrophy of the testes. B, the children are emaciated, the adolescent, the teenagers are emaciated, and there's a feminist attitude towards them, lacking in boyish go. Number 3, right testes is affected, and number 4, there's a knife-like pain in autumn met. So I'll say it's a remedy for atrophy of the testes, orchitis, rather than hydrocele. And you see it mentioned chronic induration of testes. So you'll find some degree of hardening. Induration is the old term for hardening of the testes. So although there is atrophy, there is a certain degree of hardening of the testes you'll find with autumn metallicum. Bromium is a left-sided remedy. Kent mentions this wonderfully for bromium. It's a leading left-sided remedy. And with the left-sidedness in bromium, you'll find a coolness of the testes in bromium. Cold testes, left-sided. And bromium's appearance, remember, is always like phosphorus. They're blue-eyed, bright, attractive like phosphorus. But affection is more left-sided. Left-sided glands are affected, and testes also affected with the left side, and there's a coldness in the left side testes. Coldness you may not find that often, but phosphorus appearance with left-sided testicular swelling, remember, that is important for bromium. Buforana, on the other hand, there's a very interesting thing. Many times there can be retraction of the testes into the abdomen in case of bufo. You see, I mentioned sometimes as if they would be returning into the abdomen, since as if they are pulled, they're twisted, and they go back, retract into the abdomen. The background in bufo, remember, it is a very forgetful remedy. They forget things very easily. I call it as a forgetful Baraita. I call it as an angry Baraita. I'm sorry. Why angry Baraita? Because they are very forgetful, they are very foolish, but they get really angry when you do not understand them. Baraita won't get angry when you do not understand them. But here in Buforana, they are forgetful, they do foolish things, but when you laugh at them, when you ridicule them, they get really, really angry. They will be very aggressive if they are not understood or if you ridicule them. Along with that, in bufo, in the background, lots of hypersexuality. There is a strong craving for masturbation. They want to be alone so as to practice masturbation. So, testicles wise, there's a sense of retraction. It goes back into the abdomen, pulled and twisted feeling. But remember a case where there is excessive masturbation. They want to be alone to do that. And foolish, forgetful patients who get really angry and mad if you do not understand them or if you ridicule them. Clematis erecta is another wonderful medicine for testicular affection. Remember, clematis, like apis, like lycopodium, right testes is affected in clematis. And there is induration, hard as stone in case of clematis. So right testes is affected, hard as stone, and many times you will get urinary symptoms along with that in clematis, especially in adults. Either there is interrupted flow of urine, or many times a pathology of urethral stricture in case of clematis erecta, where there is dribbling of urine. So right-sided testis is affected, testis is hard as stone, and you'll see in boricates mentioned ilioscrotal neuralgia, right half only, with urinary symptoms, where with urethral stricture there may be interrupted flow of urine in case of clematis, but it's a predominantly right-sided remedy for clematis erecta. Conium can have similar hardening of the testes, hard stone. Remember, it is Nash's trio of stony hard glands with cancerous tendency. Nash's trio of stony hard glands with cancerous tendency. Conium, bromium, carboanimalis. So here in conium also you'll find stone-like appearance of the testes, but it starts after an injury in case of conium. Our next one in this list is graphitis. Graphitis, many times the hydrocele can start after a suppressed skin disease. Graphitis is one of your remedies which has etiology from suppressed skin disease. Left side is affected for hydrocele, for graphitis. And many times herpetic eruptions can accompany graphitis hydrocele. I shared this with you earlier, if you recall, herpetic eruptions with hydrocele, single remedy rubric graphitis. So herpes on the scrotum or anywhere else with hydrocele graphitis. And here also Lilienthal approves of that. Herpetic eruptions accompanies the hydrocele, and suppressed eruptions can cause hydrocele, but predominantly left-sided. So we talked about digitalis, which was left-sided. Graphitis is also left-sided. But obviously, it's much helpful if you get a much clearer picture for graphitis. Helleborus and Lycopodium, we already talked about that, and I'll talk about Homoeopathy in a moment. Pulsatilla, very interesting. Remember, pulsatilla generally is better from pressure, but with a hydrocele, Lilienthal mentions that the testes are very sensitive to touch. The color may be bluish red, but obviously you need the temperament of pulsatilla to corroborate with that for making a prescription or orchitis. But also very many times in pulsatilla, remember, one of the etiological factors is mumps which follow up into orchitis. The patient had a history of mumps and then orchitis develop, and pulsatilla is a very wonderful remedy for that. Remember, pulsatilla and abrotenum both, abrotenum is not mentioned here, but pulsatilla and abrotenum are both remedies where mumps is generally followed by orchitis. And once the patient has had mumps, if it's a pulsatilla constitution, you can give pulsatilla as a prophylactic so that the orchitis doesn't develop. You'll see there's a line in Allen's for pulsatillar mumps, metastasis to mammary or testes. So obviously the metastasis is a sequelae, but pulsatillar can be a wonderful medicine. NBWS mumps, orchitis has developed, or NBWS mumps, never been well since mumps, you're giving it as a prophylactic so that the orchitis doesn't develop. My friends, rhododendron is another superb medicine for hydrocele. Acute hydrocele, again left-sided specially. And there's a feeling as if the glands are being crushed sensation in the testes. Somebody is crushing it with the hands. And you know rhododendron has a tremendous thunderstorm aggravation. So that's important for rhododendron. So up till now, we have studied left-sided, rhododendron, graphitis and digitalis. So remember, these are left-sided remedies for hydrocele. Whereas right-sided, apis, lycopodium, clematis are all right-sided hydrocele remedies. Silica, many times they can be sweat on the scrotum, humid spots on the scrotum, but again the generals are important for a silica prescription. Spongia is another very interesting medicine. You can prescribe spongia for cases which have been abused by the conventional medicine. Patient had a lot of conventional medicine for orchitis, didn't help. It's still recurring. So maltreated orchitis. The patient is half cured, but 50% of his symptoms remain. Maltreated orchitis. Character of pain is quite similar to rhododendron, a squeezing pain, but sometimes a squeezing associated with stitching pain in the scrotum. Rhododendron will tell you it's crushing pain, but spongia will tell you A, somebody is squeezing it, or B, somebody is putting in a needle, stitching like pain. And spongia is also aggravation motion, much like digitalis. But the comparative metromedica with digitalis was left-sided, spongia can be any side. So that's important for spongia as well. Left-sided, but again the generals are important. Many times in Thuya I have seen the hydrocele is worse at new moon and full moon. Thuya is one of the leading medicines for new moon, full moon aggravation. So left-sided testes to be affected with new moon, full moon aggravation, and that's a very important factor for Thuya as well. Interestingly, Lilienthal mentions for zincum, orchitis can result from a bruise like conium, like sambucus, like arnica. But in case of zincum, it goes from right to left. To be honest, I haven't prescribed zincum on the basis of this symptom, but if you don't know it, you won't prescribe it. So orchitis from a bruise, right to left. So summary of the sides, right-sided, lycopodium, clematis and apis, left-sided, digitalis, rhododendron, graphitis and Thuya. Now Lilienthal also mentions a few remedies for varicocele. Varicocele is similar to hydrocele, where the veins are all tortuous and they're conglomerated. He mentions two acids in this group, fluoric acid and phosphoric acid. Fluoric acid is a remedy where you can find more syphilitic affections, fistulas, whitlows. But in case of fluoric acid for varicocele, remember the sexual desire is very high. So there is always hypersexuality, excessive masturbation in case of fluoric acid, with some syphilitic features, whitlows, brittle nails, fistulas that can happen in fluoric acid. A hot syphilitic remedy. Phosphoric acid is no different. Also a acid group remedy, but in case of phosphoric acid, past history of excessive masturbation, past history of fluid loss through a lot of night emissions, and now the patient has hydrocele with mental and physical debility. Either hydrocele or varicocele with mental and physical debility. Interestingly, there is an excoriated feeling in the testes. Aesculus hypocastanum is a very underused remedy for testicular affections, especially varicocele. Remember, Aesculus hypocastanum has an affinity where there is stasis of the portal circulation, where there is sluggishness of the portal circulation. So cases of hemorrhoids, cases of varicocele where the portal circulation is sluggish, it helps to promote or stimulate that portal stasis, or take care of the portal stasis. It helps to promote the portal circulation again. So cases where you have a combination of three things, remember, constipation, hemorrhoids, backache, these three in conjunction with a varicocele works well for Aesculus. So these are common symptoms, constipation, hemorrhoids and backache. But when you put them together as a symptom complex, they become a characteristic for aesculus. With that background, the patient has varicocele, and aesculus will help to promote the portal circulation. Homoeopathy, I shared that with you earlier on, but homoeopathy is more applicable for cases of varicocele than hydrocele, because homoeopathy is a venous remedy. There is venous testis in homoeopathy. So when there is an injury to the testis which results in varicocele, which is a venous testis, that's more applicable for homoeopathy, and the testes are extremely sore to touch, like arnica. So I shared with you when we discussed injury to the hydrocele, arnica, conium and some bucus, and rustox from injury from overlifting. But when it's a case of varicocele, venous testis has developed as a consequence of injury, remember homoeopathy is one of the leading remedies, and especially if it's sore to touch, like arnica. Osmium is a very underused remedy. I haven't prescribed it, but again, as I shared with you, interesting point for osmium prescription. Varicocele produced by a deep cough coming from low down in the body. So a really strong cough, patient was coughing very badly, and that cough has stimulated the varicocele development. That cough has precipitated the varicocele development. So deep hollow cough, which is a triggering factor, which is the exciting factor, which has resulted in a varicocele to develop, osmium can be thought of. So that's also quite interesting for osmium. Pulsatile I've already shared with you, but here the temperament is important. You see, Lilienthal also approves of that. The tearful mood is important. But interesting things shared about pulsatile for Lilienthal, from Lilienthal for varicocele. Burning of testes without swelling. Many times the swelling cannot be there, but burning of testes is an interesting factor. K.C. Bhanja is a very good book which I often refer to. Here he mentions about two remedies: phosphorus for hydrocele after seminal losses, obviously phosphoric acid can come in, and conium from excessive sexual indulgence. So excessive masturbation or excessive sexual contact resulting in hydrocele, conium can develop symptoms. Also I shared with you, injury can result hydrocele in conium. So these are few of the therapeutics of hydrocele which you can find in practice. I'll share with you now the video of the patient and his mother who are just sharing how homeopathy helped them overcome this surgical condition.
নমস্কার, আমি ও হচ্ছে আমার টুইন বেবি, একদম বেবি। ওর টেস্টিসটা বড় ছিল জন্ম থেকেই। তো যখন হয়েছিল ডাক্তার বা পরবর্তীকালে যে সাইন্স স্পেশালিস্ট আমরা ওকে দেখাতাম, তিনি বলেছিলেন যে ওটা অপারেট করতে হবে, কিন্তু অপারেশনটা যেহেতু একটু রিস্কি হয়ে যাবে, সেই জন্য আমরা ওটা অপারেশন করবোটাই ঠিক করেছিলাম। তো আমরা এই ডক্টর সপ্তর্ষি ব্যানার্জিকে বহু বছর ধরে দেখাচ্ছি, ওনার ওষুধ খেয়ে আমরা খুব ভালো আছি। সেই জন্য ওকে দেখাবো বলে ডিসিশন নিয়েছিলাম। তো ওনাকে যখন কনসাল্ট করলাম, ওনার ওষুধ খেয়ে ওর টেস্টিসটা আস্তে আস্তে ঠিক হয়ে গেছে। টেস্টিসটা বড় থাকার জন্য ওর এমনি কোনো প্রবলেম হতো না, কিন্তু একটু বড় হওয়ার পর, মানে বছর 3 বয়স হওয়ার পর, ওর যখন টয়লেট করতো, তখন টয়লেট পেতো আর কি, টয়লেট তখন ওর তাতে পেইন হতো, অস্বস্তি হতো, একটা হালকা পেইন হতো, ফুলে যেত আরও বেশি করে। তো সেইটা ডাক্তারের ওষুধ খেয়ে একদম কিওর হয়ে গেছে। আলট্রাসোনোগ্রাফির রিপোর্টে এখন ওটা পুরো নর্মাল সাইজে চলে এসেছে। তো আমরা খুব হ্যাপি।